Good afternoon, everyone. This is Sandra Arevalo from Montefiore Nyack Hospital. I'm the Director of Community Health and Wellness, and this is Community Chats. And today we're going to be talking about the caregivers. We always talk about the patients and different diseases and conditions and resources for patients. But today we're going to make a stop and a parenthesis because those of you and those of us who are taking care of a person, especially with a disease like cancer, need a lot of help as well. I like to say that when someone in a family gets diagnosed with cancer, it's like the whole family has cancer. But we have resources for you if you are going through that as a caregiver, again, because, caregivers do a lot of work. Everybody is paying attention to the person with the complication, but very little attention is given to those who are taking care of the patients. So in order to talk about that, we have the best of the best today from Montefiore Nyack Hospital is Heather Boyle, who's been with us now a long time, I think, right? Heather, how long have you been at Nyack now?
I've been with the hospital for it'll be 8 years in November.
Yeah, exactly. So 8 years, it's a long time. And do you want to tell us a little bit of what is it that you do?
Sure. So I'm a social worker here in the oncology department at Montefiore Nyack. There's me and one other social worker here. We provide services and supports to patients as well as their caregivers, family members. We do things from, supportive counseling, emotional support. We help patients with transportation to and from treatment. We refer for home care services, palliative care services, outpatient therapies, hospice. We assist with ordering medical equipment for patients if needed, like wheelchairs, hospital beds, walkers, shower chairs. We refer to mental health providers in the community. And we connect patients with organizations that have meal delivery programs. So a lot of these things that we do, the services that we offer, it takes some, burden off the family member and the caregivers as well, if we're able to help with things like transportation and meals and home care services. So, in doing these things for the patient, we're also helping the family members as well.
Yeah.
Which is nice.
And I have to say, it's a great help, especially because if you're not familiar with the system, you guys are. So you know exactly who to call, when to call, what to do. Well, as caregivers, we have to navigate the system and be like, okay, where do I find this? And let me go to Google and let me make a few phone calls. You guys know everything, so you can do it 10 times faster than we do, right? So that's the great thing about doing things together. So I believe you have a PowerPoint, Heather?
I don't have the PowerPoint. No, I'm just going to be, kind of talking.
Oh, that's perfect. Okay, I like it.
Yes. All right, so we're going to be talking about dealing with a cancer diagnosis as a caregiver. So first I want to start off with the definition of a caregiver. The National Comprehensive Cancer Network defines a caregiver as an individual, often a family member or a friend, who provides unpaid care and support to someone with cancer. The support can encompass a wide range of tasks, such as grocery shopping and preparing meals, assisting with personal hygiene, assisting with using the bathroom, cleaning, doing laundry, keeping track of finances, driving patients to their doctor appointments, providing emotional support, reminding your loved one to take their medications and to adhere to their treatment plan, communicate with members of the healthcare team, take notes during medical appointments, and communicate with other friends and family to keep them updated on what's going on with the patient. So we have 3 types of caregiving. We have informational support, practical support, and emotional support. So I'll start off with informational support. A person diagnosed with cancer often feels overwhelmed and, may need what we call informational support. And that is first to learn about your loved one's diagnosis and treatment. Ask the healthcare team about, the patient's diagnosis and treatment. Understand the potential side effects of treatment. So talk to their medical providers about side effects based on the treatment that they'll be getting. Help your loved one communicate with healthcare professionals. Get to know the members of their healthcare team and have the names and contact information of those people. If you can, try to accompany your loved ones to medical appointments. If you're unable to, see if maybe, you can participate via telephone or virtually during the appointments. Prepare a list of questions for the next appointment. Those questions can include both your questions as well as your loved one's questions. And during the appointments, write down the doctor's answers to those questions and, take any other notes of anything that you think, might be important information. Then we have what we call practical support, where caregivers assist with practical matters of, activities of daily living. So this is assisting with things such as personal care, like bathing, toileting, eating, dressing. Ask your loved one to let you know if they need help with these activities. Don't just assume that they need help. Ask if they need help because, we want patients to know that, they do have some control of their care. We want them to feel some sense of normalcy and to, kind of direct their care. As far as healthcare, you may be involved in some healthcare tasks, such as administering medications or monitoring symptoms. And also you could be, in charge of organizing medications. I always suggest purchase a pill organizer to help with this. And, I know myself personally, I have medications that I take, and without my pill organizer, some days I don't know if I took them or not. So it's important, especially for cancer patients, to have a pill organizer. It's really good practice for everyone to have that. And lastly, we have emotional support, which is a very important component of support. It's hard to watch someone that you care about go through the difficult emotions that come with a cancer diagnosis. Patients often report feeling sad, anxious, angry, and scared, which are all okay emotions to feel. When you're diagnosed with cancer, it's normal to feel those emotions. And, we don't tell patients, oh, well, you shouldn't feel sad or, worried, or that's all normal. And, that's acceptable. And I always try to validate those feelings for the patient. So, listen to your loved one without judging or dismissing them. Listening and validating what your loved one is expressing is extremely important. Ask for guidance on how to be helped. This allows your loved one to feel more involved in their care. So like I was saying before, don't just assume that, your loved one needs help, bathing or, taking a shower. Ask them, let them feel that they still have control if they're able to do these things. And, let them, like I said, be, direct and involved in their care. Support your loved one's treatment decisions. A lot of times patients have, different options for treatment that they might be presented with by the doctor. Ultimately the choice is up to them and, we have to support whatever, decision that they make. Get information about cancer support groups. A support group will give your loved one a chance to talk with other patients that, are also dealing with a cancer diagnosis. They can learn from other patients about things such as how they deal with side effects or how they cope with difficult emotions. And very important also is to continue your support even after treatment. Despite feeling relieved that, your loved one is in remission, they could feel scared that the cancer might return. The end of treatment also means that they won't be seeing their healthcare team as often, which a lot of times, the healthcare team serves as a very big support to the patient. So, they kind of, sometimes patients report feeling sad, like, oh, I'm not going to, get to see everybody once a week anymore. I'll only be there every few months. So it's important to continue to be supportive of the patient, even during that time. Now, some of us might be long distance caregivers. Preferably, we live in the same area as our loved one that, might have a cancer diagnosis, but sometimes we don't. We might be in New York and New Jersey, and we might have a loved one in Florida that's diagnosed with cancer. So how do we support them as a caregiver when there's thousands of miles, between you? First thing, and very importantly, is to be organized. Keep medical records, healthcare team contact information, insurance information, advanced directives, and other important paperwork in one place together. This way, if the doctor's office calls you and says, oh, we need, your loved one's insurance information, or if they say, well, we need the phone number of your loved one's primary care doctor, whatever it may be, try to have all that information in one place so it's easily accessible to you. Get to know members of the healthcare team. So contact members of your loved one's healthcare team to introduce yourself. Get to know everyone's roles and get their contact information. More than likely, your loved one is going to have to give permission to the treatment center for the team to talk to you, which is fine. One other very helpful thing is, and I know a lot of us today are, we've used My Chart. So you can ask your loved one, is it okay if I access your My Chart? This way, even though you're thousands of miles away, you can see when their upcoming appointments are. You can see, any test results, any notes from the doctors. So that also helps you really stay on top of things. Make sure that you update emergency contact information with the hospital or the treatment center. Make sure you're listed as the emergency contact and that they have accurate information for you. I can't tell you how many times I go into a patient's chart to contact their next of kin, and it's the wrong number, or the number's been disconnected, or or it might be the wrong address. So it's very important, if you move or change your number, please let them know so that, somebody can get in touch with you if need be. It's also a good idea if you're caregiving from long distance to have someone local that can also be listed on the patient's chart, because God forbid something happens and the patient's rushed to the hospital or whatever it might be, that there's someone local that they can call and that, can easily go and be at your loved one's side. If you're going to be traveling to visit your loved one and maybe help them out a little bit, travel the smart way. Make a list of everything that needs to be done while you're there. This way, you can try to accomplish everything while you're there without feeling, stressed out, and to keep yourself focused. Build a long distance support system. So family, friends, neighbors, community agencies can provide support as you care for your loved one from long distance. Try to establish a support system for both yourself and your loved one. If family members are available but live too far away to provide hands-on support, maybe they can take care of things like the patient's financial affairs, or, taking care of, helping them pay their bills or whatever it might be. See if neighbors or friends that are local are willing to provide support with things like household chores, shopping, and transportation. There's also caregiver apps that help to coordinate care. So a caregiver app can help you coordinate things such as transportation, meals for the patient. You're going to be getting in the resource list some caregiver apps that you can go on. So the patient can create a profile, and they can input the dates and times of their doctor appointments in a calendar. And family and friends can log on to the app and say, okay, I'll take the patient to this appointment on, July 22nd, or I'll bring the patient dinner on July 25th. They can all input this into a calendar so that everybody can work together. And I mean, that's nice even for people that are caregivers that are local, to coordinate, an army of support through this app. And now, one thing that a lot of caregivers and family members ask me is, what do you do and what do you say to someone who's newly diagnosed with cancer? I don't know what to do. I don't know what to say, which is completely normal to feel that way. A lot of people feel that. So you're likely to have your own feelings when you learn that your loved one's been diagnosed with cancer. Try to balance your own thoughts with ways to be present and helpful to your loved one. Family and friends are often unsure of how to best support, their loved one with cancer. There are different ways to be supportive, and everyone has different needs as they cope with their diagnosis. There's no one right way to provide support. It's okay to ask your loved one how they're doing and let them know that you're available to talk or listen when they need it. Opening the door for communication will give them the opportunity to let you know if they're comfortable talking about their feelings. Even if they're not there yet, knowing that, you're open to this conversation will, allow them to be more willing to talk to you when and if they feel ready. People with cancer also, they want to feel some sort of normalcy. So don't forget to have conversations with them about television, movies, books, current events, just as you would have before their diagnosis. Talking about simple things may give them a break from thinking about, cancer all the time. So that's something very important to remember. Listen to the patient. This can be challenging when a patient, is first diagnosed with cancer. Try to listen without judging. This means not saying things like, oh, everything's going to be okay, or denying your loved one their own reactions, saying, oh, don't feel anxious or don't feel so sad. Allow them to have those feelings without being judgmental and just let them feel supported by you. Educate yourself about cancer. So cancer organizations such as the American Cancer Society and Cancer Care have user-friendly websites with information about diagnosis, treatment, and side effects. And those websites are going to be on the resource list that you guys will be getting at the end of this. Give advice when you're asked. Your loved one's healthcare team will give them information they need to make their decisions. Try not to say, you should try this or you should, do that. Give advice only, when your loved one asks you for advice. Support your loved one's treatment decisions. Ultimately, it's your loved one who's battling cancer. They may ask for your opinion, which is fine, but in the end, the decision is ultimately theirs. Things you can say to someone when they're diagnosed with cancer. So you can be perfectly honest with them and say, I don't know what to say, but please know that I care. You can say, I'm here for you when and if you need me. You can also say, I'd like to help. Please let me know what I can do. So, you can be perfectly honest with them about that. Now, what to not do or say when someone is diagnosed with cancer. And this is something that I hear from patients all the time, and they tell me things that, people say and do. The top two things. When a patient's first diagnosed, there's often many, friends and families rallying around them, saying they're going to be there for them, which, makes the patient feel, great and very supportive at first. Once the initial shock wears off, though, some people don't follow through on their promise to be there. And this, like I said, it disappoints patients. If you're going to be there, make sure that you're consistent, you make the effort, and you follow through on your promise. The other thing, that patients don't appreciate people saying is, I understand what you're going through, or I understand what you're feeling. The only time that someone can really say that they understand is if they themselves have had cancer. And I hope this doesn't apply to anyone, that's on this community chat right now. But if you have had cancer, you're in a position where you can act as a mentor for the patient if you're comfortable in doing so. I have a lot of patients when they come in when they're first diagnosed, I ask them about, support that they have, and they'll tell me, well, my sister had breast cancer a few years ago, so she's been, very supportive of me. And, which is great that they have someone so close to them, that is really able to, guide them through this. Of course, you don't want to hear that anybody else has had cancer, but when the patient has that person that they can connect with, it's really very comforting for them. Now, advice for caregivers, how you can help yourself, which is important. You have to make sure that you take care of yourself as well. I always tell caregivers you can't pour from an empty cup. If you don't take care of yourself properly, you can't take care of your loved one. So, it can be a positive experience being a caregiver, but it can also be stressful. So what you need to do is you need to ask for help. Create a list of tasks that you need assistance with. Reach out to friends and family to find ways other people can help. Could be things like, saying like, oh, do you think that you could do the food shopping for my sister this week? Or, tasks here and there just to take some of the, some relief off of you. Find home health care. So contact your loved one's insurance provider to see, will they cover, home health care benefits for your loved one? Learn to say no. Prioritize things that need to get done. Say no to things that can wait till a later time. Say yes to yourself. If there are hobbies or activities that you enjoy doing prior to becoming a caregiver, it's important for your well-being to continue to spend time doing those things when possible. You're probably not going to have as much time as you had before to do those things, but try to carve out some time for you to, continue to do your activities and hobbies. Pay attention to what you're eating. Keep a balanced diet. Stay hydrated. If you're going with your loved one to an appointment or a treatment that you know is going to be, a long appointment, pack snacks for yourself. Pack water. This way, you're not starving and that you're, nourishing and, replenishing yourself. Get enough sleep. Caregiving can be, emotionally and physically exhausting and draining. So make sure that, you get your sleep. Keep up with your own checkups and screenings and medications. Don't neglect your health. Stay on top of your own appointments and, getting any, screenings that you might have to get every year, getting your annual physical, your dental appointments, getting your medications. Don't forget about that. That's very important. And get emotional support. So take a break when needed. Talk to family, talk to a professional, join a group, a support group for caregivers. Okay, now I wanted to talk about the resources that you guys are going to be sent in an email. Any questions so far, Sandra?
No, no, not from our attendees, but I'm sure they will send us some. I do have a few questions though.
Sure.
Sorry, in the beginning you mentioned like many, many different resources for patients with cancer.
Mhm.
Are those only for patients from Montefiore Nyack Hospital, or can other people access those resources as well?
Other people can access those resources as well. Yes,
Okay,
absolutely.
yeah. And are those only for patients with cancer, or are they good for other uh, diseases or conditions?
Most of them are for cancer. However, the caregiver apps that I was talking about, that you can use for any disease. You can use cancer, Alzheimer's, Parkinson's, whatever it might be. Those caregiver apps can be for any disease.
Mhm. Okay. What do you do? And I know that you briefly touched on this, but there are times when you might disagree with the patient. For example, patients say, okay, I don't want to go to my treatment today. And you know it's important. Or I don't feel like taking a shower. Or
Mhm.
I don't feel like eating. And you want the opposite, of course. How
Yeah.
do you manage those situations?
As a caregiver,
Yes.
as a caregiver, if a patient's saying to you, I don't want to shower today, you can kind of try to, of course, you might want to try to convince them at first, but if they're really, saying, and strong in their feeling, I don't want to shower today, you have to respect their decision. And, maybe you can compromise, like, okay, how about we agree to do it tomorrow then? If you're not going to do it today, will you agree to do a shower tomorrow? So try to compromise with them. Eating is very difficult because due to treatment, patients lose their appetite or they feel nauseous. They don't want to eat, which is absolutely understandable. If I don't feel well, I don't want to eat either. Um, but really, and here when I speak with patients and they don't have an appetite, I really stress to them, you have to talk to your doctor to find out, is there something that you can do to increase your appetite, to decrease the nausea? Because if you're not, if you lose your appetite, you're not going to eat. You're going to become deconditioned. You're going to be too weak to receive treatment. It's a whole, domino effect, not eating. So, you can't force your loved one to eat. But I would reach out to your loved one's doctor and say, my loved one is refusing to eat. They've lost their appetite. There might be something that they can prescribe to increase the appetite or decrease the nausea. Um, I know you'll appreciate this, Sandra. Sometimes we'll refer patients for nutrition consults, so they can speak with a registered dietitian to learn, are there things that maybe I can try to get down? What can I eat that's, maybe like ensure something that's high in calories, but that I don't have to chew and swallow. And um, so, reach out to the social worker, ask for a nutrition referral, talk to the doctor, like I said. You can try to encourage the patient to eat, but if they're refusing, you can't force them. And, it's only going to make them angry and frustrated. And, I'm sure we've all in this group have at one time or another felt like, we didn't have an appetite because we were sick. So, it's really, that's hard. I would reach out to the healthcare team if you come into contact with that.
And what do you think, Heather, about people offering remedies all the time? It's like, for example, oh, I'm getting a headache. And then people are like, oh, this is what you need to take. This is what you need to do.
Hmm.
Or, I'm feeling nauseous. Same thing, any symptoms that you feel, I feel like a lot of people always want to say, do this, take that, do that, you know. And sometimes the patient might feel inclined to do what the neighbor is suggesting instead of the doctor. And as a caregiver, you get concerned. It's like, no, you cannot do that. So how do you manage?
So, I mean, you should always go with your doctor's recommendation, not what, someone else is telling you to do. Take this or take that for nausea or,
Mhm.
diarrhea or whatever it might be. You have to talk to the doctor about it and go with the doctor's recommendation. And I know here at Montefiore Nyack, and I know I'm sure with most oncology practices, there's a doctor on call 24/7. So you should be able to speak to a doctor, if it's a weekend or a holiday, and say, my loved one is, they've been, nauseous and throwing up, all weekend. What can I do? I would always, contact the doctor versus, getting advice from other people. It's very important because you don't know, someone can tell you to take this and there might be an interaction with some other medication that the patient's taking, or it might, exacerbate another side effect.
Yes, thank you.
Yeah. All right, so I'll go back to the resources that everybody's going to be sent after this is over. So there's a list for you of different organizations. And in there, I put a little description of what the organization offers, as well as their website and their phone number. So first, we have the good old American Cancer Society, which I'm sure everybody's heard of that. They offer resources for understanding cancer, managing cancer care, survivorship, and family. Then we have Cancer Care, which is another big organization in the tri-state area. They offer free in-person and online support groups for caregivers as well as family members. I'm sorry, as well as patients. So whether you're a caregiver or a patient, they do have free online and in-person support groups for you. Then we have an organization called Cancer Hope Network. They offer personalized peer-to-peer mentorship programs for caregivers and patients as well. So you as a caregiver, you can call Cancer Hope Network and say, my husband has, prostate cancer. And they can connect you with, a woman whose spouse also has prostate cancer. And they can be like your mentor, which is nice. And that's a free service. Then we have Cancer Support Community, Greater New York and Connecticut at Gilda's Club. This is a wonderful organization located in Westchester County. They offer free short-term counseling and support groups for caregivers and patients. I know a lot of us, if you're from Rockland County, I know we don't like going over that bridge to Westchester. So fortunately, Gilda's Club offers these services either in person or virtually, which is nice, or over the phone. And then there's the Caregiver Action Network. This is an organization with caregiver tools and resources. Now that website can be for any type of illness. It doesn't necessarily have to be for cancer. And then we have the Family Caregiver Alliance, also another organization with online tools for caregivers. That is not specific to cancer. And then there's another organization, Imerman Angels, which exactly like Cancer Hope Network, they offer personalized peer-to-peer mentorship programs for caregivers and patients. There's the National Alliance for Caregiving, which is another online resource for caregivers. That's for any type of illness. Then there's an organization called Soul Riders, which is located over in Westchester. They offer support groups, workshops, yoga, and meditation for caregivers and family members. And those services are also offered either in person or virtually. As I was talking about before, the caregiving coordination apps are also listed on this resource list. Those are Caring Bridge, Caring Village, and Lots of Helping Hands. And finally, my favorite resource is oncology social workers. So if wherever your loved one is going for treatment, whatever treatment center or hospital it would be, they will have oncology social workers there. So here at NIAC, it's myself and one other social worker. Her name is Nicole. And like I was saying before, we're here for not just the patient, but for the family member. We like to take some stress off of both patients and family members. So we provide them with supportive counseling and emotional support. As I was saying before, we assist patients with transportation to medical appointments. We refer patients for nutrition counseling, as well as home care services, palliative care, hospice. We refer patients to mental health providers and family members if you feel like, you need to speak with a psychologist or some other type of mental health professional. We connect patients with organizations that provide meal deliveries to them at home to help take some of that stress off the patient and the caregiver with meal preparation. We order, different types of medical equipment. And also we apply for grants on the patient's behalf. There's several different various cancer organizations that have grants for patients. And myself and the other social worker will apply for these grants to give the patients some financial assistance when needed. Because a lot of times, patients, they have to stop working and the medical bills are, accumulating, or just, all bills in general are accumulating. So we help with that as well. So any other questions from Sandra or any of the participants?
I believe there is a federal program that pays for a family member to be a caregiver. Do you know anything about that?
Yes, as far as family members getting paid. So if a patient has Medicaid, Medicaid will pay for a family member or a friend even to take care of the patient at home. That's called the CDPAP program, Consumer Driven Personal Assistance Program. So if your loved one has Medicaid, you can contact the local Medicaid office to apply for that. And what they'll do is they'll send a nurse into the patient's home to do an evaluation to say, okay, this patient qualifies for a home health aide 12 hours a day, 7 days a week, or 4 hours a day, 5 days a week, whatever it is. And then, the patient's loved one can be hired by a home health agency to provide those services. That's only if they have Medicaid. A patient can apply for Medicaid at any time, whether it's before they start treatment or after they start treatment. So, which is nice, and patients like that they're comfortable with their caregiver. It's a family member or a friend, that can provide that.
And if they are overseas, because a lot of our immigrant families, they might have family members in some other country, will this program cover for them as well so that they can bring the family member?
It won't cover as far as if you have a family member in a different country and they come here to take care of you. Unless they're a citizen and they have a social security number, they would not be able to get paid through this program, unfortunately. It has to be, someone that's here that's a citizen in order to get paid. But if, sometimes we have patients that, have family members in other countries and they say, I need to get my sister here to help me. Our office here will write letters for the consulate that the family member can bring to the consulate to allow them to come here to take care of the patient, but they just would not get paid.
Mm-hmm. Oh, that's interesting to know.
Yeah.
Okay. No, that's all the questions we have.
Okay. All right, very good. I'm wondering if we can give everyone my contact information.
Yes.
This way, if you have any questions about anything else, even if, your family member is getting treatment at a different center, it doesn't matter. You can always call me and I can, at least guide you in the right direction of, who to contact or what to do in, your particular situation.
Yeah. So Heather, do you feel that you want to share your phone number or your email or both?
I'll share both. Yeah. Is that something that I could just put in the chat box?
Yes, exactly.
Or,
And you
okay,
want to also say it loud for people who are going to be watching the recording, please?
sure. My contact information? Yes. So my phone number is 845-348-2984. And then my email address is B as in boy, OYLE at Montefiore, which is M as in Mary, N as in Nancy, TE, F as in Frank, IORE, Nyack, NYACK.org.
Very good. Thank you so much.
You're welcome. Thank you.
So we really hope that you guys make use of all these resources. Please don't overwhelm Heather with phone calls, but I'm sure that nobody will. So you're safe with us. But it's time as caregivers that we also get a hand. I feel like sometimes we give, as you said, I love the way that you said it, an empty cup cannot give much, right?
Mhm.
So it's time that accept that, especially caregivers, you can be working and then you have to take care of the person or your family member and your children and everything, and it can become very overwhelming. So Heather and her team are here to actually take some of that burden away from you. So please use those services. And thank you so much, Heather, not just for the presentation, but for everything that you do. I know
My
that being in
pleasure.
the oncology center and helping all these patients and families can be a lot. And it's certainly, beautiful, beautiful work what you do. So thank you for that as well.
Oh, thank you. I appreciate that.
Okay.
Happy to help.
And for our attendees, I'll see you next week. We're going to be talking about cervical health. So we're going to have one of our OBGYNs talking to you about different diseases of the cervix and the feminine parts. So don't miss that and bring questions to our community chats. See you next week. Thank you so much, everyone.
Thank you.
Take care.
Bye-bye.